Generally, males are at a risk of gastric cancer. People over 60 years of age are at a higher risk of gastric cancer. Likewise, alcoholics and chronic smokers are at a risk of gastric cancer. Your diet also affects who gets gastric cancer. People who eat a lot of fatty food, people who eat a lot of red meats, people who eat processed foods, processed meat, stored meat like canned meat, smoked meat, people who eat pickled meats. So these kind of people who eat very salty and processed foods, these have higher nitrite and nitrate contents which can lead to gastric cancer. There is another infection of the stomach called H. pylori. Helicobacter pylori infection can lead on to gastric cancer. Helicobacter pylori is of course an extremely common infection. In India, the incidence of Helicobacter pylori infection in the stomach is about 60 to 70% of the population has Helicobacter pylori. So not everyone who has Helicobacter pylori will develop gastric cancer, but it has been found that in some patients this persistent Helicobacter pylori infection can lead to something called atrophic gastritis, and people who have this Helicobacter pylori induced gastritis can sometimes be at risk of gastric cancer. People who are obese and people who have persistent gastroesophageal reflux disease are at risk of gastric cancer. So patients who have persistent reflux of acid and bile causing persistent symptoms like chest pain, over a period of time, the esophageal lining gets damaged and gets replaced by a new type of lining which is called Barrett's esophagus. So people who have this Barrett's esophagus are at a risk of gastric cancer. And family history is also people who have a positive family history of gastric cancer. Not just gastric cancer, people who have a family history of breast cancer, colon cancer, ovarian and endometrial cancer are also at a risk of gastric cancer. You have several syndromes such as Lynch syndrome, BRCA syndrome, then familial adenomatous polyposis syndrome. But more important than these syndromes, I think what we should realize is if any of your family member, more than one first degree, so 2 or more family members of you have had gastric cancer, or any of your first degree relatives means your brother, your parents, your kids, like that, any first degree relative has had gastric cancer at less than 40 years of age, that means you could be potentially at risk of gastric cancer, and you need to meet a gastroenterologist to check her up, to undergo regular endoscopic screening every 5 years.